Good morning, sir. I'm Hershey Radula from BSN 3H, and now I will be performing how to feed through NGT. So first assessment, doctor's order, client's level of consciousness and level of knowledge and understanding. Availability and functionality of the needed materials for any clinical signs of malnutrition or dehydration. For allergies to any food in the feeding, if the client is lactose intolerant, check the tube feeding formula. Notify the primary care provider if any incompatibilities exist. Planning. Before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of previous feedings. Prepare equipment, correct type and amount of feeding solution, 60 ml catheter tip syringe, Emesis basin, clean gloves, pH test strip or meter. Large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube or pre-filled bottle with a drip chamber, tubing and a flow regulator clamp. Measure container from which to pour the feeding if using open system. Water, 60 ml unless otherwise specified at room temperature. Feeding pumps as required. Implementation. Procedure. Prior to perform the feeding, introduce self and verify the client's identity using agency protocol. Explain to client what you are going to do, why it is necessary, and how he or she can cooperate. If inform the patient that the feeding should not cause any discomfort, but may cause a feeling of fullness. Perform hand hygiene and observe appropriate infection control procedure. Provide privacy for this procedure if the client desires it. Tube feedings are embarrassing to some people. Assess tube placement, apply clean gloves, attach the syringe to the open end of the tube and aspirate. Check the pH. Allow 1 hour to elapse before testing the pH if the client has received a medication. Use pH meter rather than pH paper. If the client is receiving a continuous feeding, follow agency protocol if the pH is equal to or greater than 6. Assess residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering feeding, check the expiration date of the feeding. Warm the feeding to room temperature. Rationale, an excessively cold feeding may cause abdominal cramps. Clamp the feeding tube. Clamp the feeding tube before all of the water is instilled. Rationale, clamping prevents air from entering the tube. Ensure client comfort and safety. Ensure the tubing to the client's gown. Rationale, this minimizes pulling of the tube, thus preventing discomfort and dislodgement, as the client remains sitting upright in Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. Rationale, this position facilitate digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspiration of the feeding into the lungs. Evaluation. Evaluate patient's response to the procedure. Document the procedure and other important data on the client's chart. Thank you. Hi, good morning, sir. I'm Hershey Radula, your nurse for today. May I know your name, sir?
Aulo.
Okay, sir, Aulo. I will be feeding you via nasal, so this may not cause any discomfort, but it may cause feeling of fullness. Did you take any medicine earlier, sir? How about your stomach? Are you feeling right now? po, sir. Okay, sir. If you need anything, sir, just call the nurse to the nursing station and I'll do it.